This is Barrett Merrill, another episode of Between Sessions. Excited to be joined today with Dr. Amanda Blackburn. She is the Vice President of Student Affairs at Richmond University in Atlanta, Georgia. Thanks for being with us today, Dr. Blackburn.
Thank you.
Absolutely. So just to jump in, as just a super high level question, I'm just curious, we talk about counseling and psychotherapy a lot. What is it about this particular space that is so helpful and brings so much healing to individuals?
I think that one common answer would be that the relationship that a mental health professional has with their client, whether it's an individual or group or couple or family, the relationship is probably what research shows to kind of be the biggest healing factor, no matter how many years of experience or what approach someone's taking. The relationship they have with their client is really healing, because often so many of the symptoms and hurts and traumas that someone might show up with in a counseling office can be due to or related to just some of the ways that they experience broken relationships or the brokenness of the world. Especially when that happens early in life, it can be really painful.
If someone came to you and was just asking, or even just considering, hey, I might want to start seeing a therapist or go to counseling for the first time, what kind of questions might you just ask them to consider in evaluating if that's a space they should enter, or maybe even just some insights from your past experiences that could help determine if counseling or psychotherapy would be a space that would be best fitting for someone?
I think it's a good space for almost anyone. I think that when you're trying to find a good fit, qualified mental health professional, you want to make sure that they have the education, right, that prepared them to do that work. You hope and want to look up and see that they're licensed and that they're endorsed by sort of the accrediting licensing bodies in their state or where they're working from. And then it's always a good idea to reach out to them to ask if you can have a phone consultation or schedule a first session and interview them a little bit, ask them some questions. What's their approach? How do they view the counseling process? What makes change happen? Those types of questions are really good and important to ask before you kind of jump in and engage in the process, as well as just making sure like you feel like the potential therapist is someone that you could maybe trust, that you might feel safe working with, because again, that relationship component is so important as someone starts to heal.
We've seen just over however many years that a lot of past generations have had a lot of maybe stigmatization around the conversation of mental health or seeing a therapist or a psychiatrist. And it seems like in some ways, the younger generations today are talking about mental health more, or talking about seeking out therapy or counseling. What, from your perspective, are you seeing as far as just cultural trends or shifts in the conversation around mental health and counseling today?
Cultural trends might include what you just mentioned, that younger generations might have less cultural barriers or stigmatism around asking for help from a mental health professional. They might be less likely to think that that makes them weak or incompetent or unable to do something on their own, but instead might access it like a tool or a third party or someone to offer help, the same way they might go to a medical doctor if they had a headache. So definitely there seem to be some trends. But just in cultural in general, I do think some of the stigmatism is lessening, that people are willing to ask for help from someone that is a trained, compassionate third party for a new perspective on what they might need to do or how they might best heal from what they've experienced.
There's a lot of content, I would say, even on social media around mental health and counseling.
Mm.
And, just the fact that it's being talked about so much, I'm there's definitely ways that it can probably be both helpful and also potentially harmful, just when some of that content's not being generated by someone who's a professional or a licensed individual. How would you encourage people just in engaging, especially the social media space, with mental health content? How would you encourage them to maybe filter through content to make sure that they're not taking in um, inputs that could actually be misleading or unhelpful in the long run?
That's a great question. It would be similar to how they might find a counselor. There's a lot of good content out there, a lot of good content creators, some who are professionals and some who are just connected to the profession in some way. But I think if there's someone that you trust from their online content, or um, consume a lot of their online content, it's always good to do a little bit of research about who that
Mhm.
person is and how they're trained. And again, like, do they have the qualifications and education or experience to be able to speak to the things that they are creating content about?
Would you recommend any, say, websites or resources that could be a good starting point?
There's a lot of great websites out there, but probably the biggest or most prominent one would be Psychology Today,
Mhm.
and they just have a great online presence for lots of professionals, and it's a good starting point to see like who's in your area and what their qualifications are, and do they work with the types of issues that you are wondering about working on in counseling. That's a good one. Almost every professional I know has created a Psychology Today profile as a starting point when they are trying to get themselves out there professionally, in the online world.
As someone who's not only a counselor but also as a professor, even a supervisor of other counselors, what do you think is most important when it comes to really equipping and shaping the next generation of therapists?
I think it's important to always be learning and growing, to be a lifelong learner and to stay humble, as we learn new things from the work we're doing and the research that's out there, and then the people that we're teaching and supervising, as well as from our clients. That I think in any of the supervisory or teaching roles, it's great to be able to speak to content or situations from a place of wisdom and experience, but it's really important um, to also listen to and grow from the experiences that students and supervisees and even clients bring.
Well, Dr. Blackburn, thank you so much for joining us today. It's really great to see you and hear from you. This has been another great episode of Between Sessions.